I'm Tiffany, the Aesthetics and Plastics Coordinator here at Graystone Aesthetic Center. If you're watching this video, you're probably already scheduled for surgery with Dr. Hargrove. In this video, I will be discussing all of the recommendations and requirements prior to surgery and what to expect regarding the whole process. If you've already had your in-person pre-op with me, this will be a helpful reminder. If you have not, we look forward to seeing you and you'll receive detailed instructions in your paperwork. First, I'd like to talk about anesthesia. General anesthesia is required for most procedures here in the Aesthetic Center, unless you've been made aware otherwise by Dr. Hargrove. Given that you will be put under anesthesia, we will require you to complete an anesthesia evaluation by phone prior to surgery. The anesthesiologist will ask about medications you're taking and your medical history to be sure you're a safe candidate to have surgery here in the Aesthetic Center. The contact information for the anesthesia group will be provided to you about 1 month prior to your surgery. We encourage you to complete this at your earliest convenience to minimize any chance of delay or cancellation, also to allow for any medical clearances that may require. This evaluation must be completed in order to proceed with your surgery. The next thing we'll talk about is foods, supplements, and medications to avoid prior to surgery. There are several medications and supplements that can contribute to bleeding during surgery. If you are taking a blood thinner and/or have a history of heart attack, stroke, or other cardiac complications, we will obtain a medical clearance from your medical doctor or cardiologist to temporarily stop that medication prior to surgery. If you take over-the-counter medications such as aspirin, Aleve, ibuprofen, or other anti-inflammatory medications, it is recommended to discontinue these about 7 to 10 days prior to surgery. All supplements and medications may be resumed the very next day after surgery. You will be provided with a more detailed list of foods, supplements, and medications to avoid at your pre-op visit. You may also be prescribed medication for your surgery, such as antibiotics or ointments. Any required prescriptions will be sent to your pharmacy the day of your pre-op. It is recommended that you pick up all prescriptions at least 2 to 3 days prior to surgery. As with most surgeries, there are eating and drinking guidelines in place for your safety. The night before your surgery, we will ask you to refrain from eating or drinking anything after midnight. We will also ask you to refrain from eating any food the day of surgery. You may refer to your guideline provided in your instructions for detailed information on when you can have certain liquids the day of surgery. Failure to comply with these guidelines may result in cancellation of your surgery. You will be provided with a post-op surgery kit at your pre-op. This includes some essential items for post-operative care. You will also be given a short list of additional items you will need to purchase that are not provided in your kit. Post-operative care instructions can vary with each procedure. Be sure to follow the instructions provided at your pre-op that are specifically for your procedure. Now it's time for you to head to the Aesthetic Center. The morning of surgery, as noted in your pre-op instructions, you will be required to either wash your face with the cleanser provided or wash your hair, face, and neck with baby shampoo. We ask that you not apply any lotions, aftershaves, or skincare on the day of surgery. Depending on your procedure, your shirt may or may not be removed. We ask that you wear something loose-fitting and comfortable with buttons down or a zipper down. We ask that you do not wear any tight-fitting clothing or over-the-head garments. Please leave any valuables or jewelry at home. If you wear contacts, have hearing aids, or removable dental devices, be prepared to remove those prior to surgery. Due to anesthesia, it is required to have someone drive you home the day of surgery. It is also strongly recommended you have someone stay with you overnight the night of surgery for your safety. Arrival time is given 1 day prior to surgery. We ask that you do not arrive earlier than your given arrival time, as that's just when we want you to be here and ready for us. Arrival time does not indicate surgery start time, and patients are often subject to a short waiting period before being taken back and prepped for surgery. Upon your arrival, you may be asked to have a seat in the waiting area until they are ready to take you back. Once they are ready for you, a staff member will take you and your driver back, if they wish, to a pre-op room and obtain your driver's contact information. Your driver may stay with you up until you are taken back to the operating room. The nurse and the anesthetist will come in and talk to you briefly. Dr. Hargrove will also come in to talk to you and take photos and mark you for surgery. At this point, the nurse will ask your driver to return to the waiting area until notified. Once surgery has started, the nurse will call your driver to let them know it has begun. Depending upon the length of the surgery or your driver's preference, they may leave the office or wait in our main waiting area for the duration of your procedure. The nurse will also contact your driver once surgery is over to advise them to head back to the office. You will then stay in the operating room until you're awake and coherent. The recovery period is typically around 20 to 30 minutes. The nurse and the anesthetist will then help you into a wheelchair and take you down the elevator and assist you into your vehicle. Once you are home, it's time to rest and recover. You will begin to follow your post-op instructions at this point. All of your post-op instructions will have been provided to you in writing at your pre-op, and answers to most questions can be found within that paperwork. And that is generally what you can expect from the point of scheduling through the surgery process up until recovery. I hope this video has been a helpful resource. Of course, if you have any further questions, please don't hesitate to reach out. If you would like to see a video on general post-op instructions, please refer to the general post-op instructions video. Thank you for choosing Graystone Aesthetic Center. We look forward to seeing you soon.